We are now online. Thank you and good afternoon, everyone. Welcome to our series on the effects of our, COVID on alcohol and drug use in the community from a clinical and a community perspective. I'm Nadine Ezard. I'm from the National Centre for Clinical Research in Emerging Drugs and also from Drug and Alcohol Service at St Vincent's Hospital in Sydney. And this series is being co-hosted by the National Drug and Alcohol Research Centre as well. So just like to thank everyone for their support of this and acknowledge the Gadigal people of the Eora Nation as the traditional owners of the land on which I'm seated today, and pay my respects to elders past, present and emerging, and acknowledge that sovereignty was never ceded. Before we get going, I just want to point out that if you do want to send in questions, just use the chat button and we'll endeavour to answer them during the presentation or at the end. And if we don't get around to it during this presentation, then we will answer some of those questions on the internet by email. We all know that COVID has changed the way that we relate to drugs and the way that we use drugs, and particularly the social isolation and distancing measures, and things are kind of changing as we emerge out of that COVID period. And we do really want to take this opportunity to reflect on what we know and what we should be doing going forward. And today I'm really fortunate to be joined by three people who have, during this period, actually conducted ethical research with participants, asking people what COVID has done for them and how that's changed their relationship with drugs. And so I'm really happy to introduce today Amy Peacock from the National Drug and Alcohol Research Centre, Garrett Prestage from the Kirby Institute, and Paul Dietze from the Burnet Institute in Melbourne. I'll let each of those speakers introduce themselves briefly before we get going. Amy?
Hi everyone, my name's Amy. I'm a Senior Research Fellow at the National Drug and Alcohol Research Centre, and I currently manage the Drug Trends Surveillance Program of work. Thanks,
Amy. And Garrett?
Yeah, Garrett Prestage from the Kirby Institute, where I've been for a very long time, and I oversee a lot of the behavioural research among gay and bisexual men, especially the cohort data.
Paul Dietze from the Burnet Institute in Melbourne, and I head up the Behaviours and Health Risks program, and one of the key programs there is our alcohol and other drug work, and I lead a couple of cohort studies and a few other kind of surveillance studies around alcohol and other drug use.
Great, thanks. Amy, we'll start with you. Can you tell us a little bit about what you've learned through your research on what people are saying about their drug and alcohol use at the moment?
Yeah, so we were lucky enough to have two projects, one which was an existing project, so the Ecstasy and Related Drugs Reporting System, where we do an interview normally face-to-face with people who regularly use ecstasy. And then we also set up a new project, so it was called the Australians Drug Use Adapting to Pandemic Threats Project. And that's where we conducted an online survey with people who regularly used illicit drugs in 2019. And we've just today released findings from both of those projects, the first wave of ADAPT and the interviews with the EDRS sample. And I guess probably the key finding is that the majority of the people we've spoken to have said that their illicit drug use has remained stable or declined. Now, it does vary by substance, and I think an important point in all of this is that it's likely that the impacts are going to be different across different groups. But yeah, quite interesting to see those very early trends around potentially reduced use for some substances.
And any particular substances that might have, or groups of people you think that might be using more or less in this period?
Yeah, so I guess as you kind of expect, when we look at the drug that has the highest percentage in terms of people saying they've increased their use, we're looking at cannabis, tobacco and alcohol, and that's across the two projects, so quite consistent there. When you flip it the other way, in terms of looking at the drugs that we see a highest percentage reporting a decrease, it's typically things like MDMA, ketamine and LSD. So it really seems to come back to, I guess, the context in which people are using. And we ask people about the motives for why their use might be changing. And it really comes back to, you know, not being out with friends, not going out to nightclubs and bars, you know, having more time on your hand. At the moment, it's not about changes in price, purity and availability. It's really the context in which people find themselves.
That's interesting. That probably ties in well with what you've been seeing with the work you've been doing, Garrett. Do you want to tell us a little bit about the Flux cohort?
Sure. So really briefly, just so people know where it comes from, Flux is an online cohort of gay and bisexual men that's been in existence since 2014. But in this context, we've reoriented the study entirely so that we can respond to the COVID situation. And basically what we've seen has been that it's about like, let me put it in context first. Most of the drug use, or a lot of the drug use among gay men is specifically for the purposes of sex. And so what we see in the data that we've got is something like 80% of men who've stopped having casual sex post-COVID-19. So massive, dramatic drop in the proportions of men having sex. At the same time, about 60% reduction in the proportions who are reporting illicit drug use. So the logical thing, of course, is if they're stopping having sex, then of course they're mostly using the drugs for sex, then it makes sense, of course, that they're going to stop using the drugs as well. At the same time, though, with the alcohol use pretty much the same, maybe slightly higher, tobacco use around about the same. And I was just looking a little while ago, and when you look specifically at certain drugs, the only drug that really stands out as being at least reasonably stable is probably cannabis. So basically what that says is that the drugs that are being used for partying, and particularly sex partying, are the ones that you see this really big drop off in. I mean, that's the guts of it. What I should explain too is that we've got these baseline data and then we're following them up week by week, every week, which is a nightmare in terms of managing it. And I was just looking this morning at the data, and what I was noticing in the week by week is that there's actually been a reason of this, the reduced proportion who are reporting that they're still using drugs. Among them, there's actually quite a large proportion who said that during the previous month that they had binged at some point. So it might be that while the overall drug use has declined, that proportion who are using might be using more heavily. Maybe, that's my conjecture at the moment. We need time to look at the data properly.
So I guess what's interesting is that Amy and Garrett, you're both talking about populations that are largely not meeting criteria for substance use disorder. So they're people that aren't using heavily and regularly and chronically, that don't actually meet criteria for a disorder and might not warrant treatment. So the picture might be a little bit different in the group of people that are using more frequently or more heavily. I don't know, Paul, from your cohort data, do you have any insights into other groups?
Sure. So I'll make reference to two of our cohort studies. So we've had the MIX cohort study, which is morphed into the SuperMIX cohort study, which is a study of people who inject drugs, running since 2008. And basically it's about 1,300 now, sample size, and we recruit people in and interview them manually. And like what Garrett mentioned around Flux, we reoriented a whole lot of our questionnaires and things like that in response to COVID. And similarly, in our VMAX cohort study, which is a cohort of people who smoke methamphetamine in the main, there's a few people who inject, but mostly smoke, in Melbourne and in regional Victoria. We've been following them up since 2016, and we again reoriented our questionnaires and shifted to online and telephone interviewing rather than our face-to-face interviewing that we've done for both of those studies. And so, yes, Nadine, they're kind of at the higher end of substance use, and so these people you might expect some bigger effects in. And in the main, we saw a few changes in the SuperMIX cohort to begin with. But and particularly surprising was, to my mind, was the fact that we didn't really see any changes in people's reports of heroin availability, heroin use, or injection, and there wasn't some big flood into treatment or anything like that, which suggests there must be stockpiles out there, given that the borders were closed so quickly. But that's now starting to change. We're seeing, basically trends emerging where people are reporting poorer quality heroin that's more expensive, and and more difficult to obtain. The VMAX cohort of methamphetamine smokers is similarly reporting things now that you would have expected. So the price of methamphetamine's increased, the availability's decreased. Some people are saying that the quality of the methamphetamine is out there is much worse. Others, almost perfectly balanced, 50-50, are saying that it's much better, which is surprising. And we're trying to pull together some other impacts that have been coming into the cohort. So for VMAX, it's really interesting. People's expenditure on alcohol has increased 6 times over. Their spending on drugs other than methamphetamine has increased as well. The spending on tobacco has gone up a little bit, but not statistically significantly. But there's some pretty big shifts there, and obviously people are in that cohort are turning to alcohol as a complement.
It's not a replacement. So they're methamphetamine. They're reporting that methamphetamine use is staying the same, but
it's just not quite showing up as being significant. And if it's less pure and those sorts of things, which is what half of them are saying, you could see it sort of offsetting like that. But yeah, we haven't mined the data further than that. One thing that I reckon is really interesting, though, is that all across both cohorts, they're all saying that their income has gone up because most of them are unemployed, and as we know that JobKeeper has gone to those people, and so people have more money, and a few of them do report having spent up really big on large quantities of drugs early in the COVID restrictions.
But just a few, so the majority aren't actually reporting that, which I think is an interesting finding also, that certainly anecdotally, clinically, what we hear is there are some people that, yes, spent that on drugs, but most of the people we speak to manage to use that money for daily living because they've previously found it quite difficult to live on the meagre amounts that they receive. Yeah,
what's surprising though is we haven't seen a change in reported crime or reported mental health or anything like that. Everything seems pretty static in the cohort in a lot of respects, which I'm surprised by. I understood that there's some pretty big mental health changes in some of the other studies that are out there, and I would have thought that we would get that. We've had a number of people picked up.
Just before that, when you're talking about mental health, I guess, though, your cohort has quite high baseline levels of mental illness.
Sure.
Surveyed them, so it's not a new thing for them to be mentally distressed, I imagine.
Absolutely. But I still expected a shift upwards or something like that. And then, because there is room to move. Now I've forgotten what I was going to say. Sorry.
All right.
Stop there.
Nadine, can I
interrupt? Yes.
Yeah, because I just wanted to pick up on the mental health stuff, because that's the thing that I think is really, really dramatic in what we're seeing in Flux, is while gay bisexual men anyway, tend to have relatively high rates of poor mental health. The Flux cohort, though, it's a very attached sample, so they're relatively comfortable. Nonetheless, we've seen really dramatic change in their reporting, self-reporting of anxiety and depression, but also the validated scale, the validated measures. We can look back how they were X number of years ago, and even last year, and look at now, and it's a significant change.
In which direction, Garrett?
Well, in direction of higher depression and higher anxiety, especially anxiety.
Yeah, okay. that during this COVID period.
Yeah.
I seem to recall that you did have some data from the Flux study that that for some men that did not use regularly or perhaps meet the criteria for a disorder, if they did report substance use in the context of sex, that their mental health was better, self-reported mental health was better than the group that wasn't using drugs.
That's how it's reported. It's not quite like that. It's more the other way. That if they're reporting very heavy and very frequent drug use, and dependent drug use especially, then their mental health is definitely associated with that.
Okay. Sorry, Amy, you wanted to say something?
Oh no, I was just going to say in terms of mental health, the same for both of EDRS and for the online cohort, we saw the majority of people saying, please ignore the dog. We saw the majority of people saying their mental health had got worse. And interestingly, with ADAPT, it was around 1 in 10 people in the cohort who said that they'd wanted to get mental health treatment since the beginning of March, but hadn't been able to. So there's clearly a bit of a gap there, and that's still with people saying that they were going online to look for resources and whatnot. So there is a need there, I think.
And did you also ask about substance use treatment?
We did, and across both samples it was really low. So I think for ADAPT it might have been, to the online cohort, it might have been less than 5% who'd engaged in drug treatment. And similar for the EDRS sample. I think what was interesting though, looking, not to move away from that, but people's looking for information. So we saw a lot of people saying that they were engaging in behaviours to try and reduce their risk of transmission of COVID or the impacts of it, and people going online or going to other information sources around that, how they could use drugs more safely. So there is, as I said, a gap in terms of mental health treatment, but people were actively seeking information to reduce their risks around drug use too.
Paul, did you ask about treatment seeking or treatment engagement in your cohort?
Yeah, absolutely. And so we got a slight drop off, if anything, in the number of people on OST in the SuperMIX cohort. So a slight drop off, but not significant. And then in terms of methamphetamine treatment in VMAX and all sorts of counselling, people wanting detox and all that sort of stuff, very few differences. In terms of people saying that they were trying to get onto treatment but were unable to, around about 15, 20% of the cohorts are saying that, but that was the same prior to COVID. So, it hadn't seemed to change very much.
Okay, so we haven't perhaps seized the opportunities that we thought going online with our telehealth intervention.
Yeah, we haven't looked at GPs, use of GPs, so we will look at that. But that would be an obvious point, especially for the methamphetamine cohort.
Yeah. And Garrett, do you ask about treatment seeking in your?
We did in the main Flux cohort, but no, we haven't asked about treatment seeking post-COVID. We've asked about engagement with health services, but that's mostly either in relation to COVID or in relation to sexual health. So I don't think that we can sort of make any sort of implications from that.
And given that you reported quite a steep drop off in change in sexual behaviour, was that accompanied by change in use of PrEP?
Yes, yeah. About half of the men who were on PrEP had stopped.
Yeah.
And overwhelmingly their reason for doing that was because they'd stopped having sex.
Because I guess one of the things now is, as we're seeing in most of Australia, I think perhaps things are slightly different in Victoria at the moment, but we're seeing a relaxation of the social distancing requirements. And I guess now's our opportunity to think about how we're going to talk about keeping safe going forward. So what kind of things would you recommend to the sector to be doing to make sure that people keep as safe as possible going forward? Garrett, have you got some messages that you think could come out of your research?
Are you talking sexually or more broadly?
Sexually or more broadly. I mean, I would have thought PrEP might be an obvious one.
Yeah, it is. And I think the obvious answer to that too is that, that there needs to be a lot more information around episodic use rather than assuming daily use. The thing that I sort of noticed in the data, and again, this is very preliminary, so it's my interpretation of what I'm seeing, but the men who had stopped tended to be men who hadn't had a sexual health checkup for a longer period of time. So I'm thinking, because their sexual health check is the same time as they get their prescription, I'm thinking, well, they're running out of PrEP, so they're thinking, I'll just stop using it and keep what I've got, rather than going to the doctor and getting another prescription filled. So that to me says that there needs to be some really careful consideration around how people either get encouraged to go back and get another prescription, or use a different form of use PrEP in an episodic way rather than constantly, so that they plan better for it. That's the most obvious thing. But I think one of the other things that's coming through is that while it looks pretty stable from what I'm seeing week on week, I am picking up in the data that men are starting to think more and more about restricting their sex to a particular fuck buddy or a particular group of men. And they're even talking about them as ISO buddies, isolation buddies. And so I think even there, that means, this is happening without any guidance. So that's where I would think, start helping them to figure out how to maneuver those kinds of decisions.
Yeah. So, and promoting sexual health checks, because we're still...
Oh, absolutely, yeah.
That's, people have put off a lot of their preventive care during this period, and the longer it goes on, there will be less preventive care going on.
Yeah, that's right. But I think one of the things I noticed too in that was that at the same time as I noticed a lot of organisations were saying, get your sexual health check so that when you go back to having sex, you'll be ready. That wasn't what men were doing. They were just retreating from engagement with health services.
Yeah. Any kind of messaging that you think can come out of what you've learnt so far from?
Yeah, I think just the interesting finding around people's stable or reduced use, and that it is so context based. And so, as you say, Nadine, as restrictions start to lift, we may see people who start to use again and use more heavily. Now, this isn't necessarily a sample with high rates of dependence, but there is that risk there with people reducing their use and then starting to kick off again, out socialising. And I guess even I was looking at the feedback on the survey where people at the end have the opportunity to write their comments, and just interested in how many people said they were worried about what happens when things go back to normal. And I don't know whether they're necessarily meaning that in relation to their drug use, but just that anxiety about, well, what happens now when things start to go back to normal. So I think, really the groups that we've got seem to be quite aware of ways that they can reduce their risk. So thinking through those harm reduction strategies that people can use. And then more broadly for me at the moment, I think what Paul was saying around those shifts in market features that they're seeing with the cohorts. And we've just kicked off with our interviews with people who regularly inject drugs this week. And even just the first few interviews we've had, people are saying heroin, purities, price has gone up. So I think we're going to start to see more things happen over the coming months. So keeping an eye on that's going to be so important.
Yeah.
And really important to monitor in terms of if that changes back,
Yeah. So Paul, just in terms of what you've seen from your cohort, are there any kind of key messages that you think we need to keep in mind as we're going forward to help keep people safe?
Well, I think certainly for the people who are using heroin, if the market does abruptly come back, we need to be monitoring that really closely, and just making sure messages, effective messages, get out to kind of take it easy for a while.
And things like take home naloxone, I guess, is...
Yeah, naloxone's a key thing, and making sure that people are aware that it's pretty easy to get onto pharmacotherapy treatment at the moment, certainly in Victoria. It's the systems have responded really well, and particularly for some of the most marginal and vulnerable homeless people, for example. And there's been a whole series of new models of care that have come out of the crisis that I think are really important to sort of keep looking at and think about whether or not we can keep them going. So with a lot of mobile outreach, really well engaged services that are able to sort of work well to get people in, and I think we've really got to take some lessons from that. I think they're doing a brilliant job. There's a Hep A cluster amongst homeless people in Victoria at the moment, and Hep A vaccinations happening in a really new way that's very effective. So, and the other thing, I remember what I was going to say, it's at the margins, but there has been a couple of our participants who have been picked up for violation of movement restrictions and been fined. And that's and the net widening that goes with that is that they're being done for drug offences at the same time, because basically, and the police say this as well, that they're finding people in cars and things like that who weren't allowed at that time. The restrictions have changed a little since then, and they were being picked up for COVID things, but it was in the process of doing drug deals and so forth, and then they've been so the consequences have been more significant for them.
Yeah, certainly there's been a heightened visibility of street attached people.
Exactly. Yeah.
And it's much easier to be obvious and be in contact with the criminal justice system in that way. I've just got an interesting comment from Eddie Mullen from Origin in Victoria, and he says that they've seen initially they saw a drop in demand for mental health services, but then in the last few weeks, 4 weeks, there's been a marked increase above normal seasonal changes. And that surveying the clinical population, there was an increased use amongst that population of substances that were easier to use at home, like alcohol and cannabis. So I guess that kind of reflects what you're seeing also in all of your cohorts, and particularly this idea that people are starting to come out and starting to really perhaps need and want more service engagement, and how we can reorient ourselves to better meet the needs of those populations. I guess my biggest concern is the idea of the change in price and purity and availability. Is that something that you observed in your cohort, Amy, or not yet?
Not yet, and I wonder if it's about the timing as well. So we were collecting the data from April until mid-June for these two studies, and looking at the EDRS data, so the interviews with people who regularly use ecstasy, most of them said availability was stable. Of those who commented for ecstasy pills, it was about half who said that had decreased. But yeah, that's one of the things we're going to be looking into, so trying to look at people's rating of price, purity and availability, and particularly interested around to see what happens with price.
So you're repeating the next wave of survey?
Yeah, so with ADAPT, to the online survey, that will start again next week. And so we will be collecting information about price and availability.
And then people that filled it in the first time?
From the people that filled in the first time, yeah. So we'll be able to capture that change for those individuals over time. And
Garrett, you said you're still collecting every week from the Flux cohort.
Yeah, it's every week. There's 400, almost 400 men who are doing it every week. And we've been getting about 90% retention each week, which is pretty amazing.
Yeah.
But I suspect that that'll fall off now as the restrictions ease. That's my main worry. We're also recruiting other men into the study, but that's proving really hard.
Okay, so if there's anyone listening or wants to pass on that detail, they just go onto the Kirby site, or we can put the link on our website if you like.
Yeah.
And Paul, have you got another wave planned to follow this up?
Oh, our studies are just ongoing, so we're providing updates. So I'm about to release another bulletin. So there's one that's gone out on the SuperMIX cohort in May. There's going to be another one on VMAX coming out, and then another one on SuperMIX within the next week or two.
Right.
And we have had that. So it was a 1/3 increase in the price of methamphetamine reported by the VMAX cohort.
Yeah. So that's I mean, it's a fascinating wrap up of what we've seen in the early phase, and I think it's really going to be crucial to watch what's happening over the next few months as well. So it'd be really great to hear back from what we know from these cohorts. So just wanted to thank everyone very much for joining me today, and we'll post some of that information on the web and the link to the Flux cohort, and talk to you all again soon. Bye.
Thanks. Bye.
Bye, everyone.
Bye.